Use with caution. Well, how do you do that? So these monthly flea and tick preventatives, let's talk about what happens when your dog takes them, when they're in your dog's body. So we're talking about these common things like Simparica Trio and NexGard and Bravecto. These flea and tick prevention monthly pills that most dogs are on. It's not only the active ingredient, the main drug in it that's associated with seizures, which is what they blame seizures on, and a lot of dogs have seizures on these drugs. Instead of the active ingredient, I think it's often the carriers, because the carriers are also drugs. Well, really, they're chemicals, but all pharmaceutical drugs are just chemicals. So what happens is, once it's in there, it's there for 30 days or more. There's no undoing it. There's no taking it back. So there's literally no possible way that you can actually use with caution, because there's nothing you can do after you've given it. You can't use with caution the way the TV commercials and the product insert says. But using that phrase protects Big Pharma from any serious liability. So let's explain a little bit more why the flea and tick preventatives are so much worse than the heartworm preventatives. So the simple heartworm preventatives that have been around for decades, like HeartGard and HeartGard Plus, they in concept are just a dose of ivermectin. They go in and out of the body in 8 hours. They don't stay in the body the whole 30 days. And that's because heartworms have a long life cycle that takes several months. And if you have baby heartworms in your bloodstream and you kill them with a dose of ivermectin every 30 days, they'll never become adults and they'll never become a problem. So the plain, simple heartworm prevention only, like HeartGard and Sentinel, I don't have that big of a problem with those because they don't stay in the body long term. But the flea and tick preventatives, they have to stay in the body as a slow release from some sort of carrier for the full 30 days, because if you think about it, if you have a flea problem, you can't just treat the fleas every 30 days. If you're in a bad enough situation where you have a flea problem, after a few days you have a major flea problem. So for these pharmaceutical drugs to work the way that they're intended from the pharmaceutical industry, that drug's got to be slow release over the whole 30 days. So it's always killing fleas and ticks and mosquitoes and things like that. But to make sure the drug works properly, the pharmaceutical company has to make sure that there's still plenty of drug in there at day 29 or 30. The drug doesn't just run out at day 30. In fact, I remember going to continuing education dinners like 10 years ago when I was still more of a conventional veterinarian. These are the continuing education dinners that all professionals have to go to once a month or something. There's a dinner, it's paid for by Big Pharma. Big Pharma has a spokesperson or an actual veterinarian who works for them who tells us all about this amazing new drug that we should be using. But anyway, I remember whatever this was 10 years ago, they would talk about exactly what I just said. The flea and tick preventatives last more than 30 days. They last for 45 or maybe 60 days in a dog's bloodstream. So their solution to these seizures and these dogs who are having itchy skin and these weird reactions to the flea and tick chemicals was spread them out to 45 or 60 days, and they'll still be covered and maybe it'll give them less negative effects. Now, Big Pharma says that because they want you to still buy their product. They don't want you to stop using it because then they don't make money. They'd rather you use it half as often than not use it at all, right? Because they exist to make a profit. All corporations and industries exist to make a profit. That means that every time you give another dose, you're adding to the leftover dose. So the very first time you give it, you're actually giving what it says. But next month, at day 30, there's still some drug in the system because that drug is tapering off over 45 to 60 days. So when you give that next dose, you're adding it on top of what's already left over from the month before. That's why we see people on these things like NexGard and Bravecto. It's after the third or fourth dose they give their dog that their dog starts having seizures, because each dose you give adds on to what was left over from the month before, and it just keeps going. So they either have seizures right away, or it's a few doses into it that it adds up to enough to start causing seizures. And then the other problem with these things is they have a dosing range. For example, a common dosing range is 44 to 88 pounds. Well, if your dog is 85 or 88 pounds, he's getting, the right dose and is less likely to have toxicity or seizures, although it's still a chemical, it's still toxic, but he's less likely to have a problem than the dog who's at the low end of that 44 to 88 pound dose. If he's 45 pounds or 50 pounds, he's getting enough drug to treat an 88 pound dog. So there's more in his system. And then there's more added up at the end of every 30 days. There's more left over that you're adding more than he needs to onto it each time. So I feel like those are the dogs that are more likely to have seizures. I haven't checked the math on this. I haven't looked at the data. But I suspect the dogs that are in the lower end of the dosing range are having seizures more often than the dogs that are at the top. Like the 88-pound dogs are not getting as much of an overdose as the 45 and 50-pound dogs when you give this 44 to 88-pound dose, okay? And then there's the fact that they don't really prevent fleas and ticks and mosquitoes from getting on your dog. They theoretically prevent an infestation because they kill these things within 24 hours or so they don't become an infestation or spread other diseases like Lyme disease. So that's okay in concept. But they're not fully preventing your dog from getting fleas and ticks and mosquitoes and heartworms into them in the first place. And that is what I talk a lot about in my book, Why Our Pets Are Unhealthy. If you can understand why the fleas and ticks and mosquitoes are a problem, why they're a problem in the environment, why they're attracted to our pets, why they get on our pets, why and how they transmit other diseases. If you can understand all that, then you can start to take steps on your own to make your pet and yourself less attractive to fleas and ticks and mosquitoes. So there's a lot of discussion about that throughout my book, Why Our Pets Are Unhealthy, and it's available on Amazon. Thanks.